When you talk about clinical outcomes, we're able to access mountains of data that were never before possible in healthcare. As the system has adopted one uniform electronic medical record, we've been able to build an enterprise data warehouse that shows us insights into the ways in which our patients experience different outcomes like never before. By combining a powerful analytics system that sits on top of that enterprise data warehouse, we've been able to drive care process models across mission in the inpatient space and in the outpatient space. Care process models are a very special thing. When you get a bunch of really bright, energetic clinicians in the room with teams who can support them, they go right to the evidence and they find what those best practices are. And we can build that into a workflow where it becomes easy to do the most data-driven and evidence-based thing. And then when you can measure the results that we're achieving in real time, you can generate some truly special outcomes. We've been able to reduce the number of patients who die from sepsis in our hospital significantly over 3 years. Patients who die in the hospital from stroke have gone down. We've been able to reduce length of stay. We've been able to standardize approaches across multiple different specialties and service lines. And doing so ultimately means that our patients experience a better outcome each and every time. The second big area of work, which is also really exciting, is around the patient experience itself. By leveraging powerful analytic models, we can get better at predicting what the volumes are going to look like in our emergency department and staff up and down to meet that demand. We can model how many surgeries we're expecting 3 to 4 days out and what the hospital census is looking like. We're even modeling right now how we build the units in the new Mission Hospital for Advanced Medicine so that we can be sure that once we're able to move into that gleaming new tower full of technology, that we'll be able to meet the patients of Western North Carolina's needs for decades to come. The final area, and perhaps one of the most exciting areas, is where we really push to the leading edge of technology, implementing solutions like ParaHealth, which is a real-time monitoring system that integrates with our electronic medical record and is able to help track patients in real time and predict if they may experience a decline. Things like Cerner Patient Observer, which has presented an opportunity to really prevent falls on multiple inpatient units at Mission and has garnered the interest nationwide of other hospitals. And finally, we have a truly unique partnership with GE Healthcare. And through the time that we get to spend with the best and brightest on their team, sitting down with the best and brightest of Mission's team, we're coming up with new ideas and new concepts that truly push the boundaries of what models can do, looking at when patients are ready to be discharged, how we can predict whether they may be readmitted, and then what we can specifically do to prevent that readmission. These are the kinds of truly exciting and innovative tools that Mission is bringing to bear to try to improve the outcomes for our patients and all 900,000 plus people of Western North Carolina. At the end of the day, what makes it most exciting for me to be working in quality and innovation at Mission is the fact that we don't do innovation for innovation's sake. We're not about buying the brightest or the shiniest new thing. Everything for us comes back to our bigger aim, which is to bring every patient to his or her desired outcome, first without harm, also without waste, and with the best possible experience for the patient, their family, and our team members.